Are you a candidate for hormone therapy? Let's debunk the myths and reestablish the facts. I'm Dr. Elena Lawa. I'm an osteopathic physician with True Health Solutions Clinic. I hope that you will find this short video clip insightful in debunking the myths and reestablishing the facts about hormone therapy. So, at what age are you a candidate for hormone therapy? At any age. If you are premenopausal or perimenopausal, and you're struggling with menstrual bleeding changes, or maybe you just entered the wonderful realm of menopause, or maybe you are in postmenopause, but you do have symptoms because the symptoms are actually red flags and vital signs of hormone imbalance that's going on in every one of us. We are surrounded by so many chemicals that definitely influence negatively the balance of our hormones. So are you a candidate? Yes, you are. Of course, it's not just taking bioidentical hormones. It's also supporting your lifestyle, improving your diet, improving your nutrition, but also absorption. Because vitamins and minerals that you extract from your diet are helpful cofactors in the production, but also metabolization of these important hormones. Our entire existence is driven by our sex hormones. So why would they increase the risk of cancer? They don't. We have our highest levels of hormones in our youth. A pregnant woman is actually bathed in high levels of hormones, and yet she does not develop cancer. So let's debunk the myths. This was first started by the WHI Women's Study in 2002, which was erroneously stopped after 5 years. But maybe thankfully so, because at the time, one arm of the study included progestins, which is a synthetic form of wannabe progesterone that has nothing to do with the functions and safety profile of our natural progesterone. And they noticed an increased risk of breast cancer. But mind you, that women in the arm group that received only estrogen did not develop an increased risk for breast cancer. Yet they published way too early, and there was significant data mining involved that scared women in the belief that hormonal therapy is increasing risk of breast cancer. At the time, they were using conjugated equine estrogen, which is a form of estrogen that comes from pregnant horses. We're not horses, we're women, we're humans. We don't have the same estrogen molecules as horses do. And horses' estrogen is significantly stronger than the potency of our own estrogen. And progestins were used, which showed a direct link to increased risk of breast cancer. Reevaluation of this WHI study was done in 2020, and yet not much was published, and not a lot of women, and even not a lot of physicians are aware that those myths have been debunked. Hormone therapy, when balanced right, is useful in eliminating symptoms of hot flashes, night sweats, sleep disturbances, vaginal dysfunction and dryness, painful intimacy, mood changes, depression, irritability, anxiety, tearfulness. Women cry for absolutely no reason, and yet the treatment is antidepressants. Ask yourselves, are you really deficient in Prozac or Cymbalta, or maybe something else that's going on that we need to look at? Hormone therapy also helps maintain sexual health, prevents your first heart attack. Let that sink in. Not the second. It prevents your first heart attack. So it maintains cardiovascular health and also maintains mental health, treats depression, anxiety, PMDD, premenstrual dysphoric syndrome. It also helps prevent osteoporosis. It helps with lubrication, with tissue plumping because of that collagen formation, things that will start wearing off as we advance in age. Maybe you have factor V Leiden deficiency, which is a coagulation dysfunction. Are you still a candidate for hormone therapy? Yes, you are, but not with oral estrogen, because oral estrogen goes through the liver and increases your clotting factors. alternatives, safe alternatives to estrogen oral would be topical estrogen therapy in the form of a patch or maybe a topical cream. Hormone therapy is beneficial. It gives you your life back, but also supports and prevents deterioration of these body functions in your old age. So I hope that now you understand that everything that has been put out there by the media has been a myth. And I hope that I have successfully debunked these myths and persuaded you to look for help. Do your research, reach out to a knowledgeable physician. Thank you.